AP 120, Lab 4, topics appendicular skeleton. So the appendicular skeleton is the four limbs of the body and the structures, the bony structures that attach them to the axial skeleton. So we'll start with the pectoral girdle. Pectoral girdle is the structure that attaches the upper limbs to the axial skeleton. The two bones that make up the pectoral girdle are the scapula, that forms a joint with the humerus, and the clavicle, which forms a joint with the sternum. So this is the actual place where that attachment to the axial skeleton occurs, between the clavicle and the sternum. Here's the clavicle, kind of S-shaped bone. All right, here's the scapula, a large flat triangular bone with some interesting structures whose names you'll need to know. This long ridge running along the back of the scapula, that is called the spine. At the end of the spine is a widened, thicker area called the acromion process. So it's spine, acromion process. Here's the acromion process again. This socket here, that is the glenoid cavity. And a little bit superior to the glenoid cavity is this bony structure called the coracoid process. So we've got spine, acromion process, coracoid process, and glenoid cavity. Here's the upper limb: humerus, radius, ulna, carpals, metacarpals, and phalanges. The humerus, or the upper arm bone, has this smooth knob called the head. The head fits into the glenoid cavity of the scapula, giving us the shoulder joint. Then also in the proximal end, we have this large rough patch called the greater tubercle, pointing out laterally, and then a smaller rough patch called the lesser tubercle, pointing out anteriorly. If we go down a little bit along the shaft, there is a rough patch here called the deltoid tuberosity. Then if we continue all the way down to the distal end of the humerus, we see that it has these two rough bony parts sticking out, the lateral epicondyle and the medial epicondyle. And the medial epicondyle is on the same side as the head, because the head always faces medially in. Then we have these smooth rounded knobs. The lateral knob is called the capitulum, and then this double bump here, that is the trochlea. And directly above the trochlea is a small depression called the coronoid fossa. Now, if we flip the humerus over to the posterior view, we see this very large depression on the back called the olecranon fossa. Here's a close-up of the elbow. Here's the humerus with the olecranon fossa. Here's the radius and the ulna. And it turns out the olecranon process of the ulna fits into the olecranon fossa of the humerus when we fully extend at the elbow. All right, here's the radius and the ulna. The ulna, as you can see, has this sort of C-shaped proximal structure, nice and smooth on the inside, called the trochlear notch. The trochlear notch fits around the trochlea of the humerus. Then sticking out anteriorly, this bit of bone is called the coronoid process. And then on the posterior side is the olecranon process. So coronoid process, trochlear notch, olecranon process. If we go down to the distal end of the ulna, we see this pointy bit sticking out distally called the styloid process. And then with the radius, at the proximal end is this smooth disc-shaped structure. That's the head of the radius. And then down at the distal end is a pointy bit called the styloid process. Also worth pointing out that the ulna is medial to the radius. The ulna is the medial bone in the forearm. All right, we have 8 carpals. These are the wrist bones. Then we have 5 metacarpals, named 1, 2, 3, 4, 5, starting off at the same side as the thumb, so metacarpal 1, metacarpal 2, etc. Then we have the phalanges. The phalanges are the bones in the finger. For most fingers, we have 3 phalanges called proximal phalanx, middle phalanx, and distal phalanx. However, for the thumb, there are only 2 phalanges, the proximal phalanx and the distal phalanx. This would be proximal phalanx 1 distal phalanx 1, proximal phalanx 2, middle phalanx 2, distal phalanx 2. So how many phalanges in one hand? It's 14. All right, here is the pelvic girdle. The pelvic girdle is made up of the two bones, right and left os coxae. They are the structure that attaches the lower limbs to the axial skeleton, specifically attaching to the sacrum. So where the os coxae connects to the sacrum, you have the sacroiliac joint, which is a fibrous joint that does not move. Sacroiliac joint. When we look at the os coxae, we see that they used to be three separate bones, but when we're in our teens, those three bones fuse together. So we still refer to those regions of the os coxae by those bone names. So superiorly, we have the ilium, anteriorly, we have the pubis, and posteriorly, we have the ischium. All right, some structures on the os coxae. Well, this large hole here is called the obturator foramen. Above that is this large socket. That socket sticks out laterally, and that socket is called the acetabulum. It helps to form the hip joint. On the posterior side of the ischium, this large rough patch here is called the ischial tuberosity. And then if we go up to the ilium, this long rough ridge running along the top of the ilium is called the iliac crest. And then this point, this bit of bone sticking out anteriorly, is called the anterior superior iliac spine. Anterior toward the front, superior toward the top, iliac because it's part of the ilium, and spine because it sticks out. All right, we also see that there is a joint that connects the right and left os coxae together. It is a cartilaginous joint made of fibrocartilage, and it's called the pubic symphysis. And then this angle between the pubis bones is referred to as the pubic arch. Here's the lower limbs, the femur, patella, tibia, fibula, tarsals, metatarsals, and phalanges. The femur, the largest bone of the body, is found in the thigh. It has this smooth rounded knob. Smooth rounded knob is called the head. The head fits into the acetabulum of the os coxae. We have this very large, rough patch of bone sticking out laterally that is called the greater trochanter. And we have this smaller, rough patch of bone sticking out posteriorly called the lesser trochanter. And then if we go down to the distal end, we have these two smooth rounded knobs, the medial condyle and the lateral condyle. And since the head always fits in medially, we know the medial epicondyle is at the same side as the head of the femur. Here's the patella, slightly triangular bone, forms the kneecap. Here is the knee joint, and as we can see, you have the femur, the patella, and the tibia. So the three bones that make up the knee joint that articulate to form the knee joint is the femur, patella, and the tibia. Here is the tibia. It is the medial bone. Here is the fibula. It is the lateral bone. They're both found in the lower leg. The tibia has a medial condyle and a lateral condyle. However, these condyles are not rounded knobs. Instead, they're smooth, flat surfaces. So medial condyle, lateral condyle, smooth and flat. Then pointing out anteriorly is this rough knob here called the tibial tuberosity. Then if we go down to the distal end of the tibia, this piece of bone sticking downwards is the medial malleolus. Medial malleolus makes that inner bump of the ankle. Also, medial malleolus means this is the medial condyle. So if you're like, is this the medial condyle? What? On the same side as the medial malleolus? Must be. Here is the fibula. And as I said, the fibula is the lateral bone. So its distal end, this rounded rough piece of bone tissue, is called the lateral malleolus. So fibula has the lateral malleolus. All right, here are the tarsals that make up the ankle. There are 7 tarsals in all. 2 of them you need to know the name of. The talus, which is the bone that articulates with the tibia and fibula to help form the ankle joint, and the calcaneus, which is the heel bone. So talus is more proximal, articulates with the tibia and fibula. Calcaneus, a little more distal, and is the heel bone. Again, calcaneus, talus, tarsals. Then we have the 5 metatarsals, 1, 2, 3, 4, 5. Again, one starts where the great toe, the big toe of the foot is. So 1, 2, 3, 4, 5 for the metatarsals. Then we have the phalanges, and again, they're also numbered and named. So we have proximal phalanx 5, middle phalanx 5, distal phalanx 5, proximal phalanx 1, distal phalanx 1. Again, only 2 phalanxes in the great toe. How many phalanges on one foot? 14. And that is it for this part of the lecture.